So hello and welcome to our session today entitled Blue Marble Thinking, How Global Perspectives Can Help Address Local Challenges. My name is Linda Crisowati and I am the Senior Program Manager for Evidence-Based Practice at AMCHP. Now more than ever, a global perspective is necessary to foster innovation and address gaps in the domestic evidence base. To do this, AMCHP has started a global evidence-based practice initiative to identify and share culturally appropriate best practices, bright spots, and insights from the global community with Title V and its partners. It aims to foster genuine appreciation for community-generated evidence and knowledge and cultural diversity in public health practice, and create a space for collaborative transnational learning in MCH. Today, we'll hear from several of our colleagues who are already engaged in this work. Dr. Kurobi Acharya directs the Global Ideas for U.S. Solutions portfolio at Robert Wood Johnson Foundation. This portfolio is focused on finding solutions outside the U.S. and bringing them into the U.S. to support health equity. Kurobi will be serving as our moderator today. We'll then hear from our three panelists. Lori Tremmel-Freeman has 3 decades of experience as a national nonprofit leader with over 15 years working within public health organizations, including recently serving as CEO of the Association of Maternal and Child Health Programs, or AMCHP, and currently serving as CEO of the National Association of County and City Health Officials, or NACCHO. Dr. Yolanda Ogbalu is a native of Baltimore, an associate professor, chair, and director of global health at the University of Maryland School of Nursing. Her research focuses on advancing health equity for vulnerable communities locally and internationally. And Melissa Sawyer is a co-founder and the chief executive officer of Youth Empowerment Project, or YEP. Knowing firsthand the dearth of services and opportunities available to court-involved youth, in 2004, Melissa and 2 colleagues started YEP to address the specific needs of high-risk young people. Over the past 16 years, Melissa has grown YEP to be the largest and most comprehensive organization addressing the needs of underserved, out-of-school, and court-involved New Orleans youth. I'll now turn it over to Kurobi to get us started. Thank you.
Thanks so much, Linda. Have you noticed that suddenly everyone has been talking about what other countries are doing to manage COVID-19? Whether it's looking at how South Korea and the European nations are handling school reopenings, or debating Sweden's questionable experiment, or like me, fawning over Jacinda Ardern's leadership, which has resulted in New Zealand's elimination of the virus. I'm excited to see how many people are looking to the world, to what the world can teach us. And that's because, as Linda mentioned, I have the pleasure of leading the Global Ideas for U.S. Solutions team at the Robert Wood Johnson Foundation, which is charged with learning from other countries and exploring what they are working on towards better health and well-being. Next slide. We've come to call this work Blue Marble Thinking. So how many of you are familiar with this photo? It was taken in 1972 by the crew of Apollo 17, the last lunar landing mission, and it's called the Blue Marble. It was the first image to capture the world in its entirety, and for many, it forever changed the way in which we would see our world. This awe-inspiring image eliminated country borders and divisions, and it demonstrated our shared humanity on this fragile planet. In our work, we found that, like those astronauts, when we look abroad, we begin to see our own country in a whole new light. And we begin to open up our imaginations to new ideas, new solutions, and new futures. I believe this blue marble thinking is going to be crucial as we look to come out of the darkness caused by the pandemic. All too often, our ability to see a path forward is obscured by biases and tendencies to see things in a particular way, and we miss all the other possible routes that we could take. So let me give you an example. Next slide. When you think of a prison, what do you see? Most of us, we see bars, cells, barbed wire. We see a structure designed to keep people in, locking them up as a punishment for a crime committed. Next slide. When you see a prison in Germany, what do you see? A German prison is designed to keep people out of prison. It's designed to help people reintegrate into their communities as quickly as possible. And so German prisoners wear their own clothes. They sleep in nice rooms with plants and art. The room locks, but the prisoner has the keys. They're even trusted to use knives in the kitchen, throw darts for recreation, and sometimes take weekend leave to spend time with their children. Their dignity is not stripped from them, it's restored. What's the result? Lower crime rates, lower costs, recidivism rates that are half what they are in the US, and almost no violence inside a prison. What if we tried what Germany is doing? If we treated the 2.3 million people incarcerated in our prisons with more respect and dignity? And the good news is that a number of correction agencies across the US are doing just that. They're actively learning from their German counterparts and bringing what ideas they can back home. So as you can see, blue marble thinking can be incredibly powerful because sometimes we have to leave our country or our comfort zone, literally or figuratively, to understand that the way we do things is not the way we have to do them. That's the idea of blue marble thinking, going to faraway places with our feet or our minds, and by doing so, seeing our own homes, our work, our challenges with new eyes. And it's exactly what these three panelists did and are continuing to do, even in the face of COVID-19 and in response to the nationwide call to end systemic racism. So I'm thrilled to lead us through a discussion with them now to explore how blue marble thinking helps them to see new opportunities to improve health and well-being for children and families. Next slide. So we'll have our panel discussion now. If you could go to the next slide. So if each of you could tell me a little bit about your work and how it helps to advance health equity and racial justice. And what we'll do is Lori will speak first, and then we'll go to Yolanda and then Melissa. So Lori.
Good afternoon, everyone, or good morning, depending where you are. I am so grateful to be with AMCHP today to dialogue with this panel and with all of you about the promise that learning from others around the world holds for our country, outside of what we may consider familiar or even comfortable, to advance the health of moms and dads, babies, kids, and their families in the communities where they live. NACHO is the only organization dedicated to serving every local health department in the nation. NATION represents and supports this country's nearly 3,000 local health departments and is the leader providing cutting-edge, skill-building, professional resources and programs that support effective local public health practice and systems, all done with an emphasis on health equity and social justice. Today, our local health departments and their leadership are well positioned to be community health strategists. They must work collaboratively across environment, policy, and systems level actions that directly affect the social and environmental determinants of health. Our mission is to improve the health of communities by strengthening and advocating for local health departments to achieve our broader vision of optimal health, equity, and security for all people in all communities. We do this work through ensuring that all health departments are able to deliver the essential public health services that are appropriate to their community, advocating for local governmental public health, and always done through partnership and alliance with others. Next slide, please. So over the last 25 years, NACHO has been working hard to focus on health equity and social justice. We know that health inequity is rooted in injustices associated with racism, sexual discrimination, social class, and all these have implications for our work, even in the maternal, child, and adolescent health field, but also in greater public health. The real work happens when we explore and put to work those strategies that can eliminate those differences. We are fortunate to have on our staff Dr. Richard Hofrichter, one of the leading experts in the field of health equity and social justice, and he remains our longest tenured NACHO employee. His work has had a profound impact on the field of public health and is transformative for nearly 3 decades and will be evergreen in the world of health equity and social justice. From developing the Roots of Health and Equity course to supporting the penning of the more recent Advancing Public Narrative for Health Equity and Social Justice, NACCHO is tirelessly devoted to exploring solutions. NACCHO's Building Networks project was an effort to align public health and community organizing, for example, where we linked public health with the discipline and strategies of community organizing in 5 states in the Midwest. These reforms refer to transforming the decision-making process and power structures that produce unhealthful living and working conditions by making them more democratic and accountable. As a result, communities begin the journey of becoming more effective and powerful in supporting the social change necessary to eliminate the health inequities. There are some other examples noted on this slide. Next slide, please. Our health equity and social justice work is also focused on longer-term policy and nationwide impact. NACCHO, through its work groups made up of local health officials from across the country and others interested in local public health, work every year to devise policy statements that guide everything from our stance on important public health topics to advocacy on appropriations and support to public statements, press releases, and media interactions. I invite you all to take a look at our policy statements related to health equity and social justice, including our statements on health and disability, health equity and social justice, immigrant health, LGBTQ health, mass incarceration and structural racism, police violence and racism, and women's health. In addition, we routinely pronounce health equity and social justice as priority areas for Congress and the administration to consider when developing national policy. These asks, a sampling of which are on this slide, help to push the health equity and social justice platform at the highest levels of our government. We have fought for everything from appropriations to support addressing the social determinants of health, to considering the mental health needs of migrant children in custody of HHS, to fighting for changes in the behavioral risk factor surveillance system so that sexual orientation and gender identity is considered. Final slide, please. Finally, we know that all of this good work can be even better if we open up our minds to how we learn from other countries who address these same issues but have had far better outcomes. Since 2018, with the help of the Robert Wood Johnson Foundation, NACCHO has been looking at some of the most challenging of issues facing local governmental public health in areas where we haven't been able to achieve the results or turn the corner in better outcomes. Everything from infant mortality to maternal mortality and morbidity to mental health and substance use disorders. We believe that through the translation of programs, policies, and practices that transcend our borders, there is a world of potential and untapped capacity to build healthier communities, reduce health inequities, ensure stronger health systems, and bring the whole world closer to real solutions to our most common and perplexing public health issues. Thank you.
Hi, I'm Yolanda Oberlu. One of the greatest lessons I've learned from my 2 decades of experience in global health is that health challenges across the globe are similar. Health challenges are not enveloped. They're not hidden by a defined border. And this really offers an opportunity for us to have global learning to advance health equity and reduce health disparities. For the past year, my team at University of Maryland, along with my community partners, the Black Mental Health Alliance, the Patients Program, and Be More for Healthy Babies Upton Mondawmin, with support from Robert Wood Johnson Foundation, have been listening to residents of 2 disadvantaged communities in West Baltimore to better understand social isolation. In Rio de Janeiro, Brazil, they have the advantage of having a 30-year-old program that has successfully tackled the problem of social isolation early in life for vulnerable families. The most important characteristic of Sal de Criança's program is the vision that social inclusion is a central aspect to health. By working with families in 5 key areas: income generation, housing, education, global citizen, and health, They strengthen family and community social networks, link family to community resources, and break barriers to inclusiveness. This program focused mostly on single mothers and their children, and works with them over a period of 1 year to help improve social inclusion. The Salve Criança program has significantly improved and sustained health, education, income, and social outcomes. In the program evaluation, participating families, when compared to a matched control 3 years following the program completion, children of families who participated had less hospital days and reduced hospital admissions by 90%. Household income per capita almost doubled as employment increased from 54% to 70%. The number of families linked to eligible services increased from 6% to 23%, and home ownership increased from 25% to 50%. University of Maryland is adapting the Salve Criança program to serve families of children 0 to 5 residing in West Baltimore. We'll be working with mothers one-on-one to provide them with the social connections they need to resources and to provide them with social connections through monthly coaching sessions. We're excited to see how strengthening social connections in these 5 categories can help these families thrive and help them feel like they're included, like they really belong to Baltimore.
Hi, everyone. It's wonderful to be with you today. My name's Melissa Sawyer, and I'm a co-founder and chief executive officer of Youth Empowerment Project based in New Orleans, Louisiana. The 3 of us who started YEP, we were 3 women who were colleagues working together at the Juvenile Justice Project of Louisiana, doing statewide juvenile justice reform for 3 years, supporting young people who were incarcerated, filing motions to modify, and helping them to come home and to reintegrate into their families, neighborhoods, and communities. One of the things we realized doing this work together from 2001 to 2004 was that there were no programs that were designed specifically to support the needs of young people who'd been incarcerated and were trying to make the very, very difficult transition home in the state of Louisiana. As such, we came together with our realm of professional as well as personal and boots on the ground experience supporting young people and designed YEP to be the first juvenile reentry program in the state of Louisiana. You can move to the next slide, Linda. Over the past, now going on 16 years, YEP has grown significantly in terms of the scope of our work as well as the number of young people that we serve. We also, although we continue to provide reentry supports to young people who are coming out of the justice system through our YEP Mentors work that you can see on this slide, we've also expanded significantly and work a lot with young people and not so young people who don't have any justice involvement, but who are looking for the supports that they need so they can fulfill their goals and their own personal potential. YEP Educate now is the largest high school equivalency program supported by the state of Louisiana that provides adult education high school equivalency for young people ages 16 and up. We focus primarily on opportunity youth, which is a subset of young people ages 16 to 24 who are disconnected from school and from work. Although through our YEP Educates program, we don't say no to any adult learners who are interested in engaging in ongoing adult basic education or to earn their high school equivalency. Illiteracy continues to be a huge issue in our country and in New Orleans as well, and we feel that it's our responsibility to break down as many barriers as possible to ensure that all individuals who want to pursue their personal goals have access to do so in an environment where they feel comfortable and welcome, and there's as few barriers to entry as possible. As such, all of our programs are also free to the individuals who choose to participate. And across all of our programs, slightly under 80% of folks are self-referred, which means that they choose on their own volition as opposed to being mandated by a court or a probation or parole officer. Through our YEP Enriches programming, YEP provides an array of after-school summer camp programs to young people, primarily in the Central City neighborhood where YEP's always been headquartered. And then we also run a weekend overnight camp for young people ages 9 to 12. It's a part of a national network of programs called Camp Mariposa, supporting children 9 to 12 who are impacted by substance abuse of a family member. Again, our mentoring work has now expanded to provide young people who are maybe on the front end of the juvenile justice system in terms of family and needs of services, or potentially on probation, as well as young people who are on parole. And then finally getting to our YEP Works programming. Again, this program is specialized to provide young people who are deemed opportunity youth with soft skills, hard skills, as well as real on the ground job training. We also run, well, not at this point in time, all 3 fully operational businesses due to COVID, but our bike shop is doing extremely well at this time because bikes are just flying off the shelves around the country and around the world. So our bike shop is fully operational at this time. We also have a thrift store where our young people practice the customer service skills that they've learned, and a digital media studio that our young people are trained in to provide these services. All of a sudden just got really dark. The reason that the YEP Works program is highlighted here is that is why I think I'm a part of this conversation today. Through the Reconnecting Youth program, and Linda, you can move to the next slide, that was supported by the Robert Wood Johnson Foundation. YEP was selected to partner with the International Youth Foundation and then an organization based in Brazil called HESJ to examine their model of providing biocentric education, which has had tremendous success in Brazil at giving young people a sense of self-efficacy, connection, and really improving both their placement and retention rates while they are apprentices and then become employees in Brazil. And again, as YEP was looking to add an extra layer of keeping our young people connected and really providing them with the depth and the breadth of nurturance and support to really fulfill their own goals, we felt like we were missing something by just really operating a more sort of traditional employment readiness program. And so spending time in Brazil over a process of 2 years and then having folks come to us and to provide some additional training was really a wonderful opportunity, and leads us to believe that there is deep potential in continuing to find ways to build upon and to integrate this model for the long term in terms of our programming.
Thank you so much to each of you. Really fascinating work. The next question I would love for you to address is, what feedback have you received from participants or the people involved with the programs you've described? How have they responded to this work, and what has surprised you? And we'll go in the same order. Lori?
Thanks so much. So over the past 18 months or so, we have held a series of focus groups with our local health departments of all shapes and sizes, including 5 big cities, 20 urban locations, and 13 rural participants, to try to delve a bit deeply into what are some of the barriers and opportunities to using global solutions for some of our most common problems. And these are some of the quotes that we've learned from them during the course of our informal research. What we learned is often surprising. Many local health departments haven't thought about the potential benefits of a global perspective, and that we likely need to provide some training materials, some workshops or other learning opportunities to facilitate how local health departments are thinking globally and understand the value that the global perspective can provide. Many local health departments express that funding is a significant barrier to any new innovation, and this is not so surprising given the defunding of the public health infrastructure that has occurred over the past decade, with over 20% of the workforce being eliminated. Global programs sometimes do not fully resonate with some funders or some broader state health departments and others due to the uncertainty associated with adoptability and adaptability. So we need to do some more work to educate others about the potential value proposition versus the risk investment. And finally, there's potential for matching global innovations with local health departments to meet the specific needs and outcomes, and showing sort of return on investment of using global strategies to address some of those really difficult public health issues where we're not making any progress and where we have the poorest outcomes. Thank you.
The feedback that I received from participants was particularly interesting. In phase 1 of our research study, Brazil to Baltimore, we engaged community members through focus groups and interviews. Residents told us that they were self-isolating from family, neighbors, and the community just to cope with living in a neighborhood where they didn't feel supported, safe, or connected. Many residents I've talked to were self-isolating not because they wanted to, but because of the situation or the environment in which they live. They did not play basketball in their neighborhood courts or participate in community life because they feared they could be swept up by violence or negative social networks that could take their lives down a different path. We know that when mothers and children weaken their social networks and are cut off from social support and opportunities, it indeed affects how well and how long they live. This situational isolation is a major threat to public health. We also spoke to community members and were surprised to hear their eagerness to seek solutions through global learning.
So yet again, through the support of the Robert Wood Johnson Foundation, had the opportunity actually to go to Brazil twice before we decided that we were really interested in bringing back the biocentric model to New Orleans and to see how our young people responded. So initially, 4 members of our leadership team went, spent significant time learning from and actually participating in biocentric education ourselves with our colleagues in Belo Horizonte, where HESJ is located. And then we had the opportunity again to bring a much larger group of our team with us to Brazil. So we brought actually 19 people, which was a mixture of senior team members, program managers, young people who were still participants and alumni of our program, to really give everyone across the board a really hands-on personal introduction to biocentric work. After that second trip, we decided that we felt there really was something special to this model and something that we didn't know, but we thought that our young people might really, really respond well to, especially because so many of our young people who came with us to Brazil, as well as our alumni, just were so overwhelmed and moved by the transformational experience that they had while they were able to participate in the process in Brazil. So as such, you can see these are just some slides. We, unfortunately, prior to COVID, were, I think, probably only able to about 4 cohorts of biocentric education, incorporating that into our soft skills curriculum here in New Orleans. But we did have the opportunity to have our Brazilian counterparts come down and to provide 2 subsequent trainings to YEP staff folks who were not able to join us in Brazil on either of the trips. So these are just some of the feedback that we received from young people. Again, as you can see, overwhelmingly positive in terms of how our young people felt about the experience personally, about what they gained from the experience, and that they would highly recommend it to others. I think to us, what was so telling about this was that this really was a very, very different way of interacting with one another, of approaching employment readiness when young people think of what they're walking into. When young people walk through the door, there's a lot of sharing, there is a lot of movement, there's music, there's dance, there's physical touch. And again, it's although New Orleans is a very intimate and I don't know, touching sort of culture, we are not necessarily right off the bat with people we don't know going to get into sort of conversations where we're automatically sharing things that are really personal and really difficult. And our young people just took to this model so quickly, and barriers were broken down that oftentimes can take weeks or never broken down in terms of the sort of trust and support that was made between young people, but also between young people and our staff people. Linda, you can move to the next slide. And these are just two quotes from two of our young people who participated. And again, as we don't have the opportunity to bring young people to participate in this, I think it's important that we hear their words and what the experience meant to them. Thank you.
Thanks so much. So our third question, I would love for you each to reflect on how has a blue marble thinking approach impacted the way you approach your work? You know, that is, how are you seeing your own work with new eyes or from a different perspective? And again, the same order, so we'll start with Lori.
Thanks so much. So we are learning very rapidly as we go here. We know from our conversations with our local public health departments that there are areas on the ground in communities that represent particularly stubborn public health issues that can continue not to be easily solved by our own methods or approaches or interventions. And through our work, we learned from our health departments that those areas where blue marble thinking might be most impactful include mental health, especially as it relates to social isolation, suicide, trauma, as well as adverse childhood experiences. Also at the top of the list was substance use disorders. The current opioid epidemic is particularly challenging, and health access also emerged as an area where we may be able to take international global solutions and apply them to the particularly challenging areas in our communities, including providing culturally competent care for immigrant populations and addressing health equity issues. And then rounding out sort of the top 5 areas of need included infant mortality, maternal morbidity and mortality, HIV/AIDS, and sexually transmitted infections and disease. Next slide, please. So essentially, we already have begun our search for implementable practices to address common local governmental public health issues, and particularly those I just identified. To highlight some of these approaches, we developed blogs and podcasts to highlight success stories where some of global practices and solutions were adopted and adapted already in local health departments in the US. These included Health on High Street. In Texas, the Harris County Public Health Department implemented mosquito programs from Brazil. In Long Beach County, they implemented a community health worker model from Venezuela. And in West Virginia, they used a South African approach for addressing sexually transmitted infections and diseases through a social media app. So we have began looking at these and hope to begin to spread some of these examples through our podcasts and through our highlights of success stories. But also we are on a search for more practices globally that can help address those top areas we've identified. When we asked the best way that that NACCHO could support global thinking, a data repository was cited by every group as a needed resource some area that our local health departments could go to that was searchable, concise, categorized, evidence-based. But I think more importantly, that provide an opportunity to connect with the global community and as sort of a mentorship opportunity to understand how these solutions were implemented in a global setting outside of our country and how they could be adapted and adopted here in this country. Thank you.
Blue marble thinking has really impacted the way I approach my work. As a native of Baltimore and working in global health for over 2 decades, I'm constantly going back and forth with my thinking about how we can take the lessons learned from abroad and apply them locally. For this project, I realized Baltimore is not alone in the challenges it faces. All over the world, underserved populations live in suboptimal conditions, often on the fringes of large cities. Rio de Janeiro in Brazil is an example where vulnerable populations have nearly identical social and health outcomes to Baltimore. These common health inequities transcend national borders, offering an opportunity for global learning to find solutions.
I think when I think of blue marble thinking, the first thing for me, just at a personal level, was one of the highlights of leading YEP for me over the past 16 years is really having the opportunity to go along with 18 other members of YEP's team on an international trip. And that's not something that we'd had the opportunity to do. More than half of both our staff and young people did not have a passport prior to the trip. And a good number of both young people and staff had never been on an airplane before. And so I think for me, it was just such, I don't know, it was a real sense of just like happiness for me to be able to share that experience with young people and staff who had such a wonderful time, whose parents were excited, grandparents were excited, kids were excited that they were having the opportunity, and how just having the opportunity to take folks to Brazil for that period of time was just really, truly transformational on so many levels. I think it also brought our team together in a way that would not have been possible had we not had that shared experience. So I think another thing that we've really been thinking about since that trip is how can we continue, and again, this was all pre-COVID, but how can we continue to build upon this experience, to try to fundraise, to find other resources, to ensure that our young people and our staff have the opportunity to travel and to interact with other young people, with other organizations doing similar work as YEP is around the country, and to share and to learn from them. I think watching our young people interact with the young people in Brazil also was very, very informative for us. I think, again, there was a huge language barrier as our young people didn't speak Portuguese and the young people we were working with didn't speak English. However, the ability for young people to connect through music and dance, and now through Google Translate, and just to be able to just share and connect. And there was such an immediate synergy, and there were so many similarities in terms of the young people's lives and the challenges that they faced in Brazil, and very similar to many of the challenges that our young people faced here in the United States. And so again, I think it was just one of those reminders that we all across the world are so much more similar than we are not, and that we have so much in common as human beings, and we all want the same things, and many of our communities struggle with a lot of the same challenges. And so how can we, again, as Americans, not put ourselves above any other entity, recognizing we have so many challenges here at home that we need to be more intentional about, and more thoughtful and more open-minded about how we're going to provide the supports that all of our people need to fully thrive and to fulfill and actualize their potential. And then how can we look to other countries and to pull resources from them and models from them to help strengthen what we're doing. So again, I think just again, on a very personal level and then on a very sort of micro level within our organization, having the opportunity to let young people travel, to see the world, to engage with members of other countries, I think is really important. And I think the more that we have that interaction, the better we're going to be as a world in terms of our patience and our kindness and our tolerance for others. And I think right now that's more important than ever before.
Well said. I you know, if COVID-19 has taught us anything, I think they've taught us what you were just talking about, Melissa, that we are so connected on this one planet. And so, you know, the next question really is around how have each of you had to adjust your work in light of COVID-19? And has Blue Marble thinking played a role in the decisions you've made? Maybe it has, maybe it hasn't. And what have you been eager to learn from abroad? So Lori, you want to start?
Thanks. So global learning around COVID-19 is really just beginning and continues to happen. We're learning very painstakingly about which strategies around testing, contact tracing, risk communication, and many other strategies, what are most effective in minimizing the spread of the virus. On the screen here is our COVID-19 dashboard that shows the trends related to COVID cases and deaths based on race. And in DC, for example, Black and Latinx people have far higher death rates per 100,000 people than white people do. We have been hearing this, we have the data. Sadly, it is not that surprising. When we learned that COVID was particularly harmful to individuals with certain underlying health conditions, we knew immediately that these conditions were already prevalent in our already vulnerable populations and communities. Our Black and brown communities already suffer from greater rates of diabetes, high blood pressure, heart conditions, obesity, and these are the very conditions that this virus thrives on. The important issue here is that we have to take action, educate, alert, inform, work within these communities on the ground to assure understanding that this virus does not discriminate and that Black and brown communities are at greater risk and must help in terms of mitigating risk and avoiding this disease. Next slide. I'm going to move through these pretty quickly because there's a lot of impacts in terms of mental health and areas around substance use disorders. According to recent articles in JAMA and the New England Journal of Medicine, the impact of COVID-19 on mental health and substance use disorders is quickly becoming an area of focus. Mental health and combating substance abuse are challenges that many countries already face. Social isolation, increased financial strain, stigma, anxiety from uncertainty may translate into unstable mental health, unsafe behaviors. And evidence from previous mental health studies post-disaster always indicate that these challenges are ubiquitous in already vulnerable populations and are greatly exacerbated by disasters. Next slide, please. Here we see the impact of COVID-19 on pregnant women. Although the death rate is only 0.2%, do we really want as a country to say that it's okay that 35 moms lost their lives to COVID while carrying their babies? I don't think so. 0 would be in a more acceptable number in a country like ours that is supposedly so advanced. Interestingly, here we also see that Hispanic and Latinas are more likely to test positive for COVID-19 than the Black non-Hispanic population. So these equity issues continue to emerge as well. Next slide. One of the more challenging issues and impacts of COVID-19 has been on the rate of adult and child immunizations. During the, from the start of COVID-19, continuing through today, we have seen declining numbers of both adults and, more importantly, or equally importantly, children being immunized against other common diseases and threats. And with this, if you add this and you layer it upon the COVID pandemic, we are just setting ourselves up for a very tough time over the next several months, addressing, how to keep our children and our adults alike safe from disease. I'll stop there. Thank you.
We have had to make some significant adjustments to our program related to COVID-19. Namely, similar to all of us, we've had to transfer the idea of the program being delivered face-to-face to virtual. In this process of really transforming the program, we've really leveraged blue marble thinking. We've collaborated with our partners in Brazil to think about decisions that needed to be made. And we've been very eager to learn from them and from their barriers and also from their solutions. It's been interesting that we've had similar barriers as it relates to the economic situation of families, the access to technology, the psychological confusion that families have faced related to missed messages, and also how culture has really driven people's response to the COVID pandemic.
So COVID-19 has definitely had a range of implications for YEP. I think that many nonprofits probably across the country are struggling with a lot of the same questions. Again, YEP is primarily a service-based organization. Our work is rooted in our youth advocacy model, which really provides young people with intensive, long-term, deep relationships with our youth advocates and with our staff. And a lot of that is based on face-to-face interaction. It always has been since we started. And so I think as an organization, we were not prepared at all, like many others were not, for the implications of COVID-19. I think we did a really good job initially of pivoting and moving all of our services virtual. So using Zoom, doing ongoing activities, teaching classes, doing a needs assessment, making sure that our young people who needed them got the technology they needed, connecting them with hotspots or other things so they could stay connected to the work, doing grocery drop-offs, creating activities related to cooking online, and really trying to be creative and thoughtful. And I think for the first several months, we did a really good job. I think, though, as others have alluded to, our young people are already vulnerable and have already been through a lot of trauma and have faced a lot of challenges in their lives. And one of the things we're seeing now is an increase in depression and disconnection. And I think the longer that this goes on, our young people and our staff as well, we're not really geared up for this to be as long as it's been. And I think now we're just seeing a lot of fatigue, and we're seeing folks who are really missing that human connection, that social interaction. And again, a lot of the challenges that others have alluded to, we are seeing in terms of our staff, but also in terms of hearing from our young people. So what we are now in the process of doing is how are we now shifting into fall programming where we can hopefully safely start implementing some more one-on-one, socially distant with mass sort of interaction. Is there a way for us to start, for example, our dance team again, where we're outside and there's social distance? What about our drumline? How do we bring that back? And so right now our program leads are really spending a lot of time working with our chief program officer about how can we be creative and adapt our services to meet the greatest needs that our young people are facing. It looks right now like New Orleans will at least be starting through Labor Day in an all virtual educational setting. And so how can YEP help address the educational equity issues that we know exist and persist? And thinking more about how are we providing tutorial support, again, making sure all of our young people have the technology, that they have the resources, and that they, again, have that one-on-one connection with a staff person who cares about them. In terms of the biocentric work, I must say that I am concerned right now about what that looks like moving forward. As I referenced earlier, biocentric is a model that is based on hugging and touching and dancing and being in close proximity with one another. It's really about making that human connection and building bonds that are based in trust and honesty and sharing early on. And I don't know how we will be able to adapt that in any sort of effective and impactful way in a sort of virtual setting. That's something that I am definitely going to reach out to our colleagues in Brazil and see what they're doing. I haven't checked in with them recently. It's been several months, but to again see how they're doing, first of all, knowing that Brazil is getting exceptionally hit hard, just as the United States is, but to check on our colleagues. And then also just to learn from them again about how they're adapting their model. One other challenge that has happened for us is that we have had to, as an organization, and I think, again, other nonprofits are facing this, really look long and hard at what are going to be the long-term economic impacts of COVID. And I don't think that any of us know at this point in time, but as an organization that relies on both public and private funding, we do have grave concern about the months to come in terms of potential contracts being reduced or grants being reduced or individual donors not having the resources to support us. So as such, we did move forward as well with an organizational reduction in force, and we are I think we're cautiously optimistic, but we're also being very, very fiscally responsible and trying to brace ourselves, recognizing that our long-term sustainability is most important and that we need to do all that we can to ensure that we get through this time, which could be a very, very difficult time for many nonprofits. So YEP is around for many years to come to continue to adapt and to grow and to address the needs of the young people and the families that we serve.
Thank you all so much. You know, it is sobering every time there's a conversation about the layers and layers and layers of impact that this pandemic is having on us. And you know, it's just very sobering, and yet it's also encouraging to hear about how you are rising to meet those challenges with each, you know, of your organizations and your work. So our last question for the session is, what is one piece of advice that you'd give to someone interested in learning about or adapting a program from abroad to our domestic maternal and child health context? What's a piece of advice? And same order, so Lori?
I'd say you have to be open, brave, and courageous, and recognize that in many cases, what we are trying to address in this country in terms of maternal and child health outcomes and interventions, it's just not working for us. It's not moving us in the direction we need to move quick enough to save important lives and to prevent further illness and impacts to our families. So we have to acknowledge that there are inherent differences in our health systems in the US versus other countries. But aside from that, you know, be open to the opportunity to look for solutions that don't feel or look like things that we've done ourselves, that our health departments in this country are very low resourced, and there are actually comparable solutions in developing countries in very low resource environments, believe it or not, that can be applied here easily enough. Because the environments aren't that different, sadly. And so I think we have to just be open, brave, and courageous. Thank you.
For others interested in global learning, I would say that one of the greatest challenges, but also one of the greatest benefits, is really the work that is necessary to put in for engaging communities. It's essential that we work very closely with communities to ensure that the global ideas that are brought forth, communities have an investment in it and are willing to participate and then are excited about the possible solutions. So building community partners locally and globally are really essential to improving maternal and newborn health problems using a global learning model.
And I think what I'd add, and again, this is from a sort of more micro level, is that looking at adapting a program and incorporating it and making sure that it is a fully integrated or a fully sustainable part of an organization's work, I think you need to really have a well thought out multi-year sustainability plan for doing that. I think that takes resources, that takes ensuring that you have enough people committed and fully trained in the model. So if you do have turnover or transition, or if there's budget cuts and unfortunately you don't have those folks anymore, how are you able to continue with the work to ensure that just getting something started and off the ground, it's not automatically just going to take off. You need to be really intentional, and it is going to take a significant amount of time. It's going to take much intention, and it's going to take resources in order to ensure that you are fully able to adapt, integrate, and then sustain the work that you want to bring into your organization.
Wonderful. Well, I so appreciate this advice to others, and I love, Lori, this idea of being open, brave, and courageous. It seems like that's a great way to end this session, and invite each of you who are listening to this, watching this, to be open, brave, and courageous, and to consider what you might have to learn from other countries, and how to learn from their experience, and to practice a little blue marble thinking of your own. So with that, I want to thank our panelists, Lori Freeman, Yolanda Ogbolu, and Melissa Sawyer, for sharing your experience and what you've learned with all of us today. And a huge thanks to Linda Krisawati, who had the idea for this panel and who has done the heavy lifting to make this happen, adjusting many times along the way as the format has shifted to virtual. So thank you all.